We should be meeting families where they want to be, not giving them one more thing that they have to do.
As a pediatrician, I think WIC provides a great supplemental set of services to our patients, and that includes both nutrition resources, so funding that they can put towards healthy foods for their child or children, but also nutrition education. We can't always provide all of the nutrition counseling we'd like to. WIC is a great opportunity to have families both reinforce what they're hearing from their pediatrician, but also sometimes ask additional questions and get additional guidance.
Pediatrics is all about primary prevention. Primary prevention means starting out with a foundation of healthy habits, whether that's eating, physical activity, sleep, healthy habits that can persist through life and prevent the burden of chronic disease. The mission of WIC is exactly that. It's all about primary prevention. It's starting during in utero to the earliest years of life to ensure a balanced diet during that time, knowing that cementing the taste preferences and habits during those years will carry kids forward.
The relationship between WIC and healthcare providers is so important because it's continuity of care. If WIC and providers are not on the same page, the same clients, participants, patients are hearing two different things, and then they're questioning either what the program is telling them or what their healthcare provider is telling them.
Technology is one way that we can make it easier for families to have the support and social interaction that they need and want.
We can call COVID-19 the era of innovation in WIC.
The COVID-19 pandemic presented a lot of challenges in terms of providing services to our participants who could not access services in person. It also really spawned a lot of innovation in WIC clinics and agencies across the country.
We really needed healthcare providers to share height, weight, and iron levels with us because we were not setting eyes on those kids or even those pregnant women. We learned how to do phone appointments and video calls, and we taught our participants, how to upload stuff from their text messaging to an email so we could get it.
The pandemic has kind of fast forwarded us to seeing all of the benefits of using virtual platforms, telehealth models, to reach families in ways that we couldn't before. Let people decide what will work best for them.
As families change, we need to ensure that we are meeting families where they are, that we are building a program that is innovative in the ways that families also receive healthcare services to ensure that we're keeping up with technology and the ways that families access healthcare.
Our generations are different now. They're more tech savvy. They're more apt to want to do a remote appointment than come in person.
We've transitioned in the last few years to telehealth services, and as a result, increased our data sharing partnerships with healthcare providers.
Improving data sharing and communication between primary care providers and WIC offices would make a big difference, both so that primary care offices could provide direct WIC referrals, but also to reduce the redundancy of these measurements. So if someone just got their hemoglobin, blood level, and height and weight checked at their pediatric visit, that could be sent right over to WIC, and then the WIC provider would have that information and wouldn't have to do any redundant measurement or testing. I think improving data sharing will also help to make sure that families feel like WIC visits and doctors' visits work well together.
I could envision a situation where a parent comes to see their pediatrician and could have the opportunity to talk to someone from WIC right there.
At 2 of our clinics, we've just started asking caregivers of children ages 0 to 6 months whether they're interested in help getting enrolled with WIC. For families who say they are interested, we give them information about their local WIC clinic. We're trying to not only give families information about the program, but really help get them across the finish line and getting enrolled. I hear families talk about how meaningful WIC is as a source of nutrition and nutrition education, how it helps them keep food on the table. But I also hear about their challenges, how they had to take an Uber back and forth across the city with their sick child just to get benefits, or how they had to walk around the grocery store for 45 minutes trying to identify eligible items. And then when they got to the checkout counter, they were told not everything they had was included. So I hear both about the benefits of the program and about the challenges they face. And I think that helps me understand how critical it is to modernize the program and help all families get access to these benefits.
I think there's great opportunity with increasing partnership between pediatric primary care and WIC to make the healthy choice a little bit easier for families.